Welcome to the deep dive. Today, we're going to be looking at eosinophilic esophagitis,
Okay.
or EoE for short.
Yeah,
It's a mouthful, I know.
it is.
But if you're curious about this condition,
Right.
maybe you're dealing with it yourself or you know someone who is,
Yeah,
then you're in the right place.
for sure.
We've got a whole stack of research,
Uh-huh.
medical websites, patient guides,
Awesome.
all to help us really
Mm.
unpack EoE
Right.
and to help us make sense of it all.
Yeah.
We have an expert in gastroenterology here with us today.
Happy to be here.
All right, let's jump right in.
Sounds good.
I think a lot of people hearing eosinophilic esophagitis
Right?
for the first time might be wondering,
Yeah.
what even is that?
It's a great question.
It is a great question.
EoE is a chronic condition where a type of white blood cell
Okay.
called eosinophils
Mm-hmm.
builds up in your esophagus.
Ah,
You know that tube that carries food from your mouth to your stomach?
right, like a food highway.
Exactly.
Yeah. But why are too many eosinophils a problem?
So think of it this way.
Okay.
When your body senses something that it thinks is harmful,
Uh-huh.
it sends these eosinophils to fight it off,
Okay.
which is a good thing.
Right.
But in EoE, they kind of overreact
Okay.
and they cause inflammation in the esophagus.
Ah, so it's like they're fighting an imaginary enemy in your food highway,
Exactly.
causing
Yeah.
traffic jams.
Yeah.
So does that mean the main symptom is trouble swallowing?
Exactly. Yeah.
That's one of the biggest red flags for EoE.
Mm-hmm.
But here's where it gets tricky.
Okay.
The symptoms can actually mimic other conditions,
Oh, no.
like acid reflux or GERD.
Oh, okay.
So that can make it tough to pinpoint EoE right away.
So it's like a bit of a medical mystery.
You could say that.
Okay.
Yeah, to add another layer,
Uh-oh.
the symptoms can actually vary a lot depending on your age.
That's interesting. Okay.
Yeah.
So what should parents be on the lookout for with their babies or toddlers? So for little ones, you might see things like frequent vomiting,
Okay.
refusing to eat,
Yeah.
or even having trouble gaining weight.
Mm-hmm.
They're just not growing and developing as expected.
Makes sense.
Yeah,
It must be so worrying for parents when their kid isn't eating.
absolutely.
So then what about older kids and adults? How does EoE usually show up?
Well, as we mentioned, difficulty swallowing, it's
Okay.
a common one,
Uh-huh.
especially for older children and adults.
Right.
They might also experience heartburn, chest pain,
Okay.
or even abdominal pain.
So it really does mimic those GERD symptoms.
It does, yeah.
Makes it tricky.
It does.
And in more severe cases, you said food can get stuck.
Yeah, so in more severe cases,
Good.
food can actually get completely stuck in the esophagus.
Oh, wow.
We call that food impaction,
I-
and it can be a medical emergency.
That's scary.
Yeah.
You mentioned food getting stuck.
Yeah.
Does that mean people with EoE have to be super careful about what they eat?
Yeah, you're right on the money there.
Okay.
EoE is often triggered by an allergic reaction in the esophagus.
Okay.
Certain foods are common culprits.
Okay.
Like dairy, eggs, peanuts, tree nuts, seafood, soy, and wheat.
So many.
Yeah, we call them the big six.
The big six.
Yeah.
I've heard that term before.
Yeah.
Like the A-list of food allergens.
Exactly.
But doesn't that make meal planning really difficult?
It definitely can be.
So we've talked about EoE being linked to allergies.
Yes.
Is it similar to other allergic conditions?
There's definitely a connection.
Yeah.
People with EoE are much more likely to have other allergies,
Okay.
like asthma, hay fever, eczema, or food allergies.
Okay.
And interestingly, having a family history of EoE also seems to increase your chances.
Oh, interesting.
Uh,
It's like all these allergic conditions are part of the same puzzle.
yeah, they do seem to be connected.
So let's say someone suspects they might have EoE.
Okay.
What's the first step?
The most important thing is to talk to your doctor.
Okay.
They'll ask about your symptoms, medical history,
Mhm.
and if they suspect EoE, they'll likely refer you to a gastroenterologist,
Okay.
a doctor who specializes in the digestive system.
That seems logical.
Mm-hmm.
And what happens at the gastroenterologist's office?
So the gold standard for diagnosing EoE is a procedure called
Oh boy, here we go.
an esophagogastroduodenoscopy,
Yeah.
or EGD for short.
EGD.
Yeah.
Another mouthful.
I know, right? It might sound intimidating, but it's really not that bad. The doctor uses a thin, flexible tube with a camera on the end to look at the lining of your esophagus. And you're under anesthesia, so you won't feel a thing.
So they can actually see if there are any changes in the lining.
Exactly.
So it's like a little peek inside the food highway. That's a great way to put it. I want to loop back to something you mentioned earlier
Okay.
about those rings in railroad tracks.
Ah, yes.
What exactly are they?
Yeah, so those are some classic signs of EoE that
Really?
we often see during an endoscopy.
Okay. What exactly are they?
They are visually striking.
Okay.
So rings refer to those circular bands or indentations
Okay.
that can form in the esophagus.
Okay.
And railroad tracks are the whitish lines that can appear
Okay.
along the length of the esophagus.
Okay.
Both are caused by inflammation and scarring.
So they're like the telltale footprints EoE leaves behind.
Exactly.
Okay, great.
Strong indicators that something is going on
Gotcha.
and warrant further investigation. And during the EGD,
Mm-hmm.
the doctor can also take tiny tissue samples, biopsies.
Right.
Yeah, these are examined under a microscope
Yes.
to look for those telltale eosinophils.
Exactly.
So it's like a two-part detective mission.
It is.
First, a visual inspection,
Yes.
then checking for those microscopic clues.
Exactly.
And if they find those eosinophils, that confirms the diagnosis.
It does.
Okay, great.
Now, once EoE is diagnosed, the focus shifts to treatment and management.
All right, so let's talk about treatment.
Yeah.
What are the options?
So typically, treatment involves a two-pronged approach.
Okay,
Medications and dietary changes.
gotcha.
Sometimes both.
Makes sense. All right.
Yeah.
Let's start with medications.
Okay.
What kinds of drugs are typically used for EoE?
So one option is corticosteroids,
Okay.
which are powerful anti-inflammatory medications.
Yeah.
They can help reduce the inflammation in the esophagus.
Right.
Sometimes proton pump inhibitors are used as well.
PPIs. Yeah.
Aren't those typically used for acid reflux?
That's right.
Oh, interesting.
Yeah, they're more commonly known for treating acid reflux.
Okay.
But in some cases of EoE,
Uh-huh.
they can be helpful.
So it's like a 2-for-1 deal,
it can be.
tackling reflux and EoE.
Yeah.
What about those newer medications we hear about, like biologics?
You're talking about a newer class of medications called monoclonal antibodies.
Okay.
These are becoming increasingly important in treating EoE.
Hmm.
They work by specifically targeting the inflammation involved
Wow.
in EoE.
Okay.
And in fact, the FDA has approved one specifically for EoE
Oh, wow.
in patients 12 years and older.
That's good.
Yeah.
So
Yeah.
let's talk about these new treatments.
Okay.
First up, Dupixent.
So this is exciting because
Yeah.
Dupixent is actually the first FDA-approved treatment specifically for EoE.
Wow.
So it doesn't just mask the symptoms, it goes right to the source of the inflammation.
So it's not like just taking a painkiller to cover up the problem.
Exactly.
It's more like
Yeah.
getting rid of what's causing the pain in the first place.
You got it.
Okay.
Imagine your immune system is sending all these signals that are telling your esophagus to stay inflamed. The Dupixent blocks those signals,
Gotcha.
like cutting off the communication lines that are fueling the fire.
Okay, now I'm starting to get it.
Good.
So how soon can someone expect to see results?
Well, the clinical trials showed people started feeling better
Mm.
with their swallowing within 4 to 8 weeks.
Oh, that's pretty quick.
But it is recommended to stay on the treatment for at least 16 weeks
Okay.
to really see how well it works.
Makes sense.
If you don't see any improvement after that point,
Yeah.
talk to your doctor about maybe trying something else.
Right.
Yeah,
But we can't ignore the cost.
true.
The source said that the average price for a 30-day supply of Dupixent is over $5,000.
Oh, wow.
That's a lot of money.
It is a lot.
And even though most insurance plans cover it,
More than 80%?
there are usually restrictions.
Yeah, you're going to want to check your specific plan,
Right.
see what it covers.
And are there any financial assistance programs available?
Good point. Yeah, definitely check that out.
Good advice.
Yeah.
And what about side effects?
Sure.
The source mentioned injection site reactions, eye problems, even infections.
Right.
That's kind of scary.
It's important to remember that everyone reacts differently to medications.
Right.
Some people might just have some mild discomfort,
Okay.
while others might have more noticeable issues.
Okay.
The key is to know the risks
Uh-huh.
and talk to your doctor about any concerns.
Definitely. And speaking of things to talk to your doctor about,
Yeah.
the source said that you should avoid certain live vaccines like measles, mumps, and rubella
Right.
while taking Dupixent.
Yeah, that's because,
Can you explain that?
yeah, so live vaccines, they contain a weakened version of the virus.
Okay.
And since Dupixent affects your immune system,
Right.
there's a small chance the vaccine could actually cause the illness
Oh, wow.
that it's supposed to protect against.
So it's better to be safe than sorry.
Always better to be safe.
Talk to your doctor
Ab-
about any vaccinations
Yep.
while you're on this medication.
Definitely.
Now, one last thing about Dupixent.
Okay.
It's a biologic drug, right?
It is.
What does that mean for someone considering this treatment?
Biologics are really complicated to manufacture.
Okay.
That's why they're usually more expensive.
Right.
And it's really hard,
Yeah.
almost impossible to make a generic version.
Oh, wow.
So that keeps the price high.
Gotcha. Okay, so we've learned a lot about Dupixent.
Yeah, we have.
Let's move on to the other treatment you sent us info on.
Okay.
EoHelia.
All right.
It seems to work differently.
It does. This one's pretty interesting.
Hey.
It's an oral solution,
Okay.
unlike Dupixent, which is an injection.
So you take it by mouth.
You got it.
Okay.
It's a liquid form of budesonide,
Okay.
which is a corticosteroid,
Uh-huh.
been used for a long time to treat inflammation.
Right.
But EoHelia is specifically designed for the esophagus.
So they took an existing solution
Yeah,
and tweaked it to address this specific problem.
exactly.
That's interesting.
And it's designed to coat the esophagus
Okay.
to deliver the medication right where it's needed.
Interesting.
It's a pretty unique formulation.
Uh-huh.
It actually becomes more fluid so you can swallow it easily,
Okay.
and then it goes back to its original form.
Wow, that sounds pretty high tech.
It is.
And it comes in these pre-mixed stick packs.
Right.
So I'm picturing someone managing their EoE
Yeah,
discreetly
right. On the go.
on the go.
No need for injections or refrigeration.
It's a game changer.
Yeah, especially for people who need that convenience and portability.
For sure. But the source did say
Yeah.
that it's important to follow the instructions.
Oh, absolutely.
There's shaking, snipping, squeezing, swallowing, and rinsing.
Yeah, it's a process.
It is a process.
But it's all designed
Right.
to make sure the medication is delivered effectively
Okay,
and to minimize any side effects in the mouth.
that makes sense.
Yeah.
Now, we don't know exactly how budesonide works to treat EoE,
Mm-mm.
but research shows it does reduce eosinophils
It does.
and other inflammatory cells in the esophagus.
That's what we want.
That's what we want.
Less inflammation, fewer symptoms.
Right. And that leads to relief from those EoE symptoms.
Exactly.
It's interesting that the source pointed out that budesonide
Yeah.
has actually been used for years
Mm-hmm.
in compounded prescriptions for esophagitis.
It has.
So it's not a brand new thing.
It's not brand new.
They just made it more convenient.
Well, right, they made it more user-friendly.
User-friendly, exactly.
Definitely a win.
Definitely a win.
Yeah.
Okay, so we've talked about both Dupixent and EoHelia.
We have.
What are the main takeaways when we compare them head-to-head?
So they both have shown promising results in treating EoE.
Okay.
They both target inflammation,
Mm-hmm.
but through different ways.
All right.
So Dupixent, as we talked about,
Yeah.
blocks those specific inflammatory signals,
Right.
while EoHelia, with its budesonide,
Uh-huh.
it acts on a wider range of inflammatory cells.
So different approaches,
Right.
but same goal.
Exactly.
Reduce inflammation.
Reduce inflammation.
And that difference in how they work
Yeah,
affects how they are given.
absolutely.
Dupixent is an injection every other week,
Right.
and EoHelia is taken by mouth twice a day.
That's right.
That's something to consider
Definitely.
based on your preferences and lifestyle.
For sure.
So it sounds like
Mm,
talking to your doctor is crucial
absolutely.
when you're deciding between these two treatments.
It is.
There's a lot to think about.
There is a lot to think about.
And that's where your doctor's expertise really comes in.
Yes, definitely.
They can help you sort through everything
Yeah,
and figure out the best way to go.
absolutely.
Okay, so that covers the medication side of things.
Right.
Let's dive into dietary changes now.
Okay.
What does that typically involve for someone with EoE?
So remember the big 6 food triggers we talked about?
Yes.
Well, dietary changes often start with eliminating those,
Okay.
at least temporarily. That means no dairy, eggs, wheat, soy, peanuts, tree nuts, or seafood
Oh my gosh.
for a while.
So it's like giving the digestive system a break
Oh, yeah,
and
exactly.
then slowly reintroducing things.
Exactly.
What about cases where the esophagus is already narrowed because of the inflammation?
That's where a procedure called endoscopic dilation comes in.
Endoscopic dilation. That sounds a little intense.
It is, yeah.
What exactly is involved in that?
It's actually a fairly common procedure.
Okay.
If the esophagus has narrowed due to scarring,
Uh-huh.
this procedure can help.
Okay.
It involves using a special balloon
Mm-hmm.
inserted through an endoscope.
Okay.
Remember that tube with the camera
Right, right.
to gently stretch the esophagus.
So it's like a widening project for the food highway.
That's a great way to put it.
Now, it's important to keep in mind
Yeah,
that everyone responds to treatment differently.
they do.
Managing EoE is a long-term process.
It is.
It's a journey, you could say.
A journey, absolutely. Okay, now aside from the physical aspects,
Yeah,
does living with EoE have an emotional or psychological impact?
that's a really important point.
Yeah.
Imagine constantly having to worry about what you can and can't eat.
Right.
or even being afraid of food getting stuck.
Yeah.
It's totally understandable that people with EoE might experience anxiety
Yeah.
or even develop a fear of swallowing called phagophobia.
Phagophobia.
Yeah.
Wow, I hadn't heard of that.
So EoE isn't just about the physical symptoms, it's about the mental and emotional toll as well.
It is, yeah.
That's why having a strong support system is so important.
Absolutely.
And maybe even considering mental health support if needed. Now, one last question before we wrap up this part of our deep dive.
Okay.
What's the long-term outlook for people with EoE?
The good news is that EoE is not a life-threatening condition.
Oh, okay.
And with proper management,
Mm.
whether through medication or dietary modifications,
Okay.
many people can live completely normal, healthy lives.
That's definitely reassuring to hear.
Yeah.
But does having EoE put you at a higher risk for developing other conditions?
That's a great question.
Yeah, like cancer, for example.
So EoE actually does not appear to increase the risk of esophageal cancer.
Oh, okay, that's good.
Yeah.
And it's also important to note
Mhm.
that EoE is different from a condition called eosinophilic gastritis.
It is.
They both involve eosinophils,
Yes.
but EoE affects the esophagus,
Right.
while eosinophilic gastritis affects the stomach.
Exactly.
So two different conditions.
Completely different conditions.
Two different parts of the digestive system.
Yes.
This has been so informative.
It's been great.
For those who are newly diagnosed,
Okay.
what advice would you give them?
Take a deep breath.
Okay.
It's a lot to take in at first.
Right.
But remember, EoE is manageable,
Mm-hmm.
and there's a whole community of people out there who understand
Yeah.
exactly what you're going through.
That's an important reminder.
Yeah,
It's not a journey you have to take alone.
it's not.
What else would you recommend?
Don't be afraid to ask questions.
Okay.
Your doctor is there to guide you
Mm-hmm.
and help you make informed decisions about your care.
Knowledge is power.
It is.
What else?
Don't underestimate the importance of mental health support.
Okay.
Living with a chronic condition like EoE can be stressful.
Yeah.
So taking care of your emotional well-being
Yeah.
is just as important as managing the physical symptoms.
Absolutely. It's about a holistic approach
It is.
to your health, not just focusing on the physical.
Exactly. And lastly, remember that research is constantly evolving.
Yeah.
New treatments and therapies are on the horizon,
Mhm.
offering hope for even better outcomes in the future.
Oh, like science is catching up with the condition,
Yeah,
giving us more tools to fight back.
exactly.
I love that.
Yeah.
Now, we've talked a lot about the medical aspects of EoE,
Yes.
but I'm curious,
Yeah.
what are some of the biggest misconceptions about this condition?
That's a great question. A common one is that EoE is just a fancy name for acid reflux.
Okay.
While the symptoms can be similar,
Right.
they are distinct conditions
Right.
with different underlying causes
Okay.
and different treatments.
So it's not just a matter of popping an antacid and calling it a day.
Exactly.
What else?
Another misconception is that EoE is something you can just grow out of.
Oh, okay.
Unfortunately, that's not the case.
Right.
It's a chronic condition
Yeah.
that requires ongoing management.
Okay, so no magical age where it just disappears.
I wish.
Yeah.
And here's another one I often encounter.
Okay.
The idea that EoE is solely caused by food allergies.
Okay.
While food sensitivities are a big factor,
Right.
there are other things at play too.
Okay.
Like environmental allergens, even genetics.
So it's like a complex web of factors.
It is.
Okay.
Yeah, debunking these misconceptions is really important
Yeah.
so that people with EoE can get the right diagnosis and treatment.
So it's about raising awareness and educating both patients and healthcare providers.
Absolutely. The more we understand about EoE,
Yeah.
the better we can manage it.
Okay, we've covered a lot of ground today.
We have.
What are some key takeaways for our listeners?
So, if you're experiencing symptoms
Okay.
that suggest EoE,
Yeah.
like difficulty swallowing, chest pain, or food getting stuck,
Uh-huh.
talk to your doctor.
Early diagnosis is key.
Exactly.
Yeah.
Effective treatments are available, both
Yeah.
medications and dietary changes
Mhm.
that can really improve your quality of life.
It's a manageable condition.
It is.
Okay, good. And for our listeners,
Yeah.
we hope you've gained a deeper understanding of EoE
Mm-hmm.
and feel empowered
Yeah.
to advocate for your health
Absolutely.
or the health of someone you care about.
For sure.
Remember, knowledge is power. It is. Before we wrap things up,
Yeah.
what are the most important things for our listeners to remember about EoE?
So first and foremost, if
Okay.
you're experiencing any of those telltale symptoms,
Yeah.
difficulty swallowing,
Right.
chest pain, food getting stuck,
Yep.
talk to your doctor.
Early diagnosis is so important.
It is. The sooner EoE is diagnosed,
Yeah.
the sooner you can start exploring treatment options and start feeling better.
What else should our listeners keep in mind?
It's so important to remember that EoE is a manageable condition.
Okay.
There are effective treatments available,
Mm-hmm.
both through medication and dietary changes,
Right.
that can really improve your quality of life.
So there's hope.
There is
It's not a condition that people have to just suffer through.
absolutely not.
Okay, good.
There are things that you can do to take control of your health
Right.
and start feeling better.
This has been such an enlightening conversation.
It has been.
Thank you so much for joining us today
Thank you for having me.
and for sharing your expertise with our listeners.
Absolutely, my pleasure.
And to our listeners,
Yeah.
thank you for tuning in to The Deep Dive.
And before we sign off, I want to give another shout out to the Center for Digestive Health and Nutrition. Their website is an amazing resource for anyone who wants to learn more about digestive health, with tons of information, articles, even recipes. It's all there.
So big thanks to them for all the great work they do.
Yes, thank you.
Remember, you're not alone in this journey.
You're not.
And as always,
Yes.
keep exploring, keep learning,
Keep learning.
and keep diving deep.
And keep diving deep.